Well, hello, everyone. APHA is the oldest and largest association of public health professionals and advocates for the nation's health. We have over 50,000 organizational and individual members representing the full range of people in the field across all states and territories. We've been around for over 150 years, founded in 1872, aggressively working to promote the public's health. So we've been in this debate for a long time. I'm going to start by answering a couple questions that Senator Kennedy could not or would not at his hearing the other day. Just for the record, the COVID pandemic resulted in 1,230,906 deaths from the beginning of the epidemic, that as of August 2nd of this year. We actually have good numbers on that. We know deaths. In fact, we have a forensic pathologist here who's going to speak to you last today. So we actually know these numbers. I understand there's questions about whether people died of COVID or with COVID, but we do pretty good counting. A lot of things we're estimating, but we do pretty good counting on that one. You know, it's also, we know that the Commonwealth Fund, using really sound methodology, looked at how effective the COVID vaccine was, and we know that from December 2020 to November 2022, it prevented approximately 3.2 million deaths and 18.5 million hospitalizations. The COVID vaccine works, and it saved lives. We know that currently test positivity is on the rise, and wastewater surveillance shows increases in several communities, despite the fact that we have a fractured testing system right now. We're not capturing things like we were doing during the pandemic. We actually know, because CDC actually on their website tells us a bit about the disease burden that we've had from 2024 to 2025. These are preliminary numbers, but they're the best numbers that we have right now, that we've had 12.7 to 19 million COVID illnesses, 3 to 4.5 million outpatient COVID visits, and over 350, almost 500,000 hospitalizations, again, estimates. And I think what's important is that COVID is still here with us. While the pandemic in its global form has moderated some, it's still here. We know from a presentation at the ACIP the last minute from CDC that nationwide 152 children died of COVID last year, half of whom were previously healthy. I think that undermines the issue of whether or not we should vaccinate even healthy children, and that most of those kids were unvaccinated, and about a fifth or 20% of those were hospitalized, were admitted to intensive care units. We also know that if you're a woman of childbearing age or pregnant, you're much more likely to get sick from COVID-19 compared to those who are not pregnant. You're more likely to need hospitalization or intensive care or the use of a ventilator or special equipment should you get COVID, and that long COVID is an enormous risk to those patients. Let me just reiterate what the senator said. Vaccines are safe and effective, and by the way, the public agrees with us. There was a recent NBC News Decision desk poll that was done from August 13th to September the 1st of this year, which showed that 78% of the public strongly or somewhat support vaccines. So all this stuff you hear about people being concerned about vaccines, yeah, there's a little bit out there, but the public is with us on this story. Now, so far, this administration has demonstrated they're not being transparent in their decision-making. They have undermined the well-structured processes to ensure vaccines are carefully reviewed to be safe, effective, and accessible. You know, even today, there's a story about people who are eligible for Medicare, who are having trouble getting their vaccine. Think about that. They have certainly removed qualified members of committees, particularly the ACIP, and have not replaced them with people of the same competency. In addition, there are enormous concerns about the names that are being floated around and the proper vetting of these individuals or the credentials for infectious diseases. So the goal of the FDA and the CDC is to make sure that the public's health is protected, and I think they're failing at that. Secretary Kenny has overseen the largest destruction of the nation's public health system in American history. We reject the destruction of these efforts. We reject the unscientific approach to controlling infectious disease, and we call on the administration to ensure full access to COVID vaccines for all and to reverse course to strengthen, not weaken, the nation's vaccine safety systems. Thank you.